Okay, hi, my name's Corey. I'm going to be doing the pubic and breast part of the assessment for the physical assessment video. So I'm going to provide my patient plenty of privacy for this procedure. So I've already confirmed, because I've just finished the rest of the physical assessment, and I've already confirmed my patient's name and date of birth. This is Pat Jones, and I'm going to walk into the room and say, okay, so now comes the time when we're going to do the breast exam and the pubic exam part of the assessment. Is that okay with you? My client says that it is okay. So what I'm going to do is I'm going to raise you up, okay? And what we're going to do, I'm going to sit you up a little bit. Okay, I'm going to put on some gloves. Okay, Mrs. Jones, what we're going to do now is we're going to do the breast exam part, okay? So I can ask my patient, do they, if they do at-home breast exams, and if they do they find anything abnormal, or do they have an abnormal history that I might need to know about? My client states that she doesn't know anything abnormal, and that she does do at-home breast exams. So do you have any discharge out of your nipples or anything abnormal like that? My client states no. I'm going to expose your breast for this part of the exam. Is that okay with you? My client states that it is. So I expose my client, and I'm looking for symmetry. I'm looking for correct color of skin and nipples, and making sure that everything's nice and symmetrical. There's no abnormal dimpling. I can also palpate in the armpits and feel swollen lymph nodes and things like that. I can also have my client put her hands on her hips, and this will give me a different view for dimpling and other symmetry abnormalities. Okay, so everything looks good. I'm going to cover you back up, okay, Mrs. Jones? Okay, so I cover my client back up. Now, now comes the time that we're going to do the pubic part of the exam. So I'm gonna put some new gloves on after I wash my hands. Okay. So my client is okay with me doing the pubic part of the exam as well. So I'm gonna put some new gloves on for this part of the exam. Okay, Mrs. Jones, what I'm going to do is I'm going to expose you here. Is that okay? Yes, it is. Okay, and we're going to take a look here. Is that okay? Yes. Perfect. Okay, so on this part of the exam, I'm going to look for tissue breakdown, any lesions, abnormal skin colors. I'm going to make sure I see the pubic hair is intact and appropriate. I can even palpate right above the pubic symphysis and see if they have any bladder distension. And I can ask questions like, do you have any discharge that's abnormal? Do you have any urinary incontinence or anything like that? My client states that everything seems normal down here. I can also palpate the inguinal area for swollen lymph nodes as well. So Mrs. Jones, I'm going to cover you back up, okay? So I cover her back up, and there is no abnormal findings. I'm going to cover my client back up as well. Going to perform hand hygiene and lower her bed back down. And that concludes my breast and pubic part of the physical assessment. Mrs. Jones, do you have any questions or concerns that I need to know about? My patient states no, that there is not. So I'm going to cover you back up a little better, okay? And I'm going to hand you your call light. It's right there. Okay, if you need anything, just push this button here, and I'll be right down the hall, okay? So I'm gonna perform hand hygiene one more time before I leave the room. And that concludes my breast and pubic part of my physical assessment.